been a paradigm shift. So it's been changed the way I select, I execute, and I complete a full-on surgery. Hi, my name is Balaji, and I've been using GuidedSMILE for the last 2 years. The lab essentially has been absolutely great because very clear systems of communication with them. So when I send off information to them, there is a very clear checklist of what they want. So like photos, scans, CBCT scans, soft tissue scans, and they're very particular about what they want. And then once that's all been sent off and they've received it, they then set you a timeline of how much it's going to take, what time scale it's going to take to get each stage done. Okay, and once that's done, and at every point there is communication, so I know exactly whom I'm dealing with, and then they send me the planning, they send me a video, and sometimes James has his points of markers which he thinks is critical to the surgery, and then once I'm happy with it, I then send it back to them with my approval. In case I have concerns, then I flag that up, that gets addressed, and if it's a major one, then James again jumps in and then discusses that with me, and then once you found a solution, then it gets into execution. The support has been fantastic because the first couple of cases, James scheduled a huge call with me so that then he could run through stages which he thought was pertinent for me to understand. And then for the first surgery, I did have someone from the Quoris office come in and be there all along to make sure that if I was going to slip up, there was somebody over there to make sure that's always there. I knew I was doing conventional freehand surgery, and there's always a case of the surgery took long and you're trying to, and sometimes you planned something and it was never exact enough to what you planned, and you're trying to minimize errors, make it more accurate placements. And then when I looked at what GuidedSMILE was offering with regards to full art surgeries, I realized that's the opportune moment for me to transition. Now select cases differently, I plan it differently, and then execute it differently. So it's actually become a better experience for me. It's become a better experience actually for the patients, and even for the practice, because it essentially it takes shorter time to get a lot of work done, and it's more predictable. Previously, conventional freehand surgeries meant that it took longer time, so the tiredness factor crept in. Now with it being using guides, it's just made the surgery a little bit more quicker, and the patient experience has always been, I mean, the patients have liked it. I mean, I had a patient for whom I'd done a lower arch conventional, traditional freehand, and then subsequently I did his upper through the GuidedSMILE, and the moment I finished surgery, the first thing he said, "Why did we do this for the lower one?" So I thought that was a good advertisement for the whole system. So in terms of precision and efficiency, the GuidedSMILE comes with metal stackable guides which are aligned essentially absolutely precisely, which means that there is accurate implant placements and it minimizes errors. So it actually has to fit into place when you put the implant in, so it's dead accurate. The first thing is a lot of things like implant numbers, the sizes of implants that's going in is all laid out. Then the system, the GuidedSMILE also gives you a surgery mat. So it's like a cheat sheet that we stick on the walls. It has got all the details, and it's also got the scan section, so you know exactly what's going where. So previously for traditional surgeries, I used to have cheat sheets, but surgery mat is an absolute blessing in disguise. So it makes me just literally have to turn around, look at what I'm putting at what position. There is definitely an increase in the high value treatments, simply because patients speak to patients, so they know exactly what's being delivered. Uh, and then, as I've said, when they see the guides and they see how efficient the process is, they are more keen on taking that up rather than have traditional freehand surgeries done. Actually, I wasn't considering many other options. I was already using guided smiles for smaller cases. So for full arch surgery, it was obviously the first choice. And then once I saw their workflow, my decision was made much easier. I mean, since I've started on the journey on Guided Smiles since last 2 years, the support and the mentorship has been absolutely amazing. I've not been able to fit in time to attend a course over there, but that's never stopped James and his team from helping me with answering my questions and making sure that I was able to deliver the best care to my patients. I'd probably say try it once, okay, and then there'll be no turning back. So it's happened essentially for me. So I tried it, and then it's not been any turning back. I've just gone on to doing more cases with it. Yes, I would recommend Guided Smile because it just makes the whole process absolutely easy and efficient.